Hello, everybody. So I'm putting together some different notes for you on some different YouTubes, and I have some notes about parathyroid problems. I'm going to share my screen and discuss them with you. So parathyroid problems. Quick reminder, parathyroid hormone is usually abbreviated PTH. And its whole job is to regulate the balance between calcium and phosphate levels in the blood. So calcium and phosphate kind of are yin and yang to one another. So just so that you're aware. So if there's parathyroid hormone in the system, it stimulates calcium resorption into the bones. And then those renal tubules won't let it pass out in the urine. So it keeps calcium out of the urine and it puts it into the bones. Parathyroid hormone, to be able to get it to the calcium resorption in the bones, also activates vitamin D. So hyperparathyroidism will increase the calcium levels in the blood. If you have too much PTH, you'll have too much calcium in the blood. And there's a few different reasons for this. You can either have loss of appetite, constipation, fatigue, muscle weakness. A lot of people with kidney failure will have problems with hyperparathyroidism, kidney stones, pancreatitis, cardiac changes in osteoporosis, and that osteoporosis is fractures in long bones, also in the ribs and in the vertebrae. So to be able to help this out, having too much PTH, usually we do surgery. We can remember that the parathyroid gland is 4 little buttons on the thyroid gland. So we can remove one all the way up to all 4. And in this case, we would use general pre-op and post-op nursing considerations that we talked about in week 1. There really isn't a medication to treat the parathyroid itself. IV fluids may help. Loop diuretics increase that calcium excretion. So if our calcium levels are too high, we can give a little loop diuretic, otherwise known as, the most common one you're familiar with is furosemide or Lasix, that opens up the renal tubules and creates a urine stream that's not very concentrated. However, then we have to do some cardiac monitoring to make sure that we don't lose other electrolytes than just, because we will lose other electrolytes, not just calcium, when we use a loop diuretic. So hypoparathyroid is really uncommon, except for people with a thyroidectomy. Like if you don't have a thyroid, there's no place for the parathyroid gets lost in the bunch, because there's no real like transplantation. They're not like, the parathyroid hormone isn't excised off of the thyroid hormone and then replanted someplace in the body by any means. It does cause hypocalcemia, so low blood calcium, and low blood calcium leads to tetany, spasms in skeletal muscles. It can also lead to smooth muscle spasms too. So these people will have laryngospasms, they'll have difficulty swallowing. It can also cause hypotension because the effect on smooth muscles. Numbness and tingling in the lips is a common effect of hypocalcemia, as well as serious dysrhythmias and cardiac arrest. Muscles need calcium to do that ion channel that does the muscle contractility. If there's no calcium, the ion channel is broken and there's no contractility. Low parathyroid is also treated with IV calcium infusion. So that's pretty much all I have to say about parathyroid problem. So I will see you in another YouTube or in class.